Welcome to One on One. I'm Steve Adubato. Everything you wanted or needed to know about knee or hip replacements, you're about to find out. We have Dr. Asit Shah, who is Associate Chief, Department of Orthopedics, Englewood Hospital Medical Center. Good to see you, Doctor.
Thank you. Good to see you.
We were just saying, before we started the show officially, the doctor said, hey, listen, shape and size matters when it comes to hip, knee replacements, all kinds of replacements, right?
Absolutely.
First replacement, was it a knee?
First replacements around knee replacements, yeah. In the 1970s, we did our first ones. And
what was going on then? What were we talking about? And by the way, you said we didn't even know the difference between a left or a right knee.
We didn't. We were just exploring even how to approach the knee to do a knee replacement. And we had no idea how metal will react with the body, what kind of bearing surfaces or plastics will react with the body. So we were just exploring it.
And today?
It's huge. It's a huge billions of dollar market. And lots of people get it done.
Okay, so here's the thing. As it's changed, as the whole field has changed, as technology has changed, excuse me, as people's expectations have changed, no longer all metal.
No longer all metal.
What are we talking about? By the way, you've brought some, I hate to say props, because they're not props. Steve Barshi, you got this?
I'll show you
they're
real
not props
quick.
because they're real.
Yeah, these are real implants.
Steve, you got that, buddy?
The side profile of the implant, and you can see it glides back and forth.
All right.
And then this is a front
Which
profile.
one's that?
This is a knee replacement.
Got it.
I don't have a hip replacement with me, but this is probably more one of the most complex joints in the body.
Okay, man, here's my question. Hold that right there.
Mm-hmm.
Because size matters so much in this case like this, you were saying someone who, for example, is Asian.
Mm-hmm.
Is it true that in general, people who happen to be Asian, a guy who's Asian, tends to have a smaller knee than someone who is a different ethnic or racial group and therefore would need a different knee replacement?
Absolutely. One of my main focuses on research and design has been the Asian knee. And the markets in Asia are growing at approximately 50 to 60% compared to the US. And the US knees don't work well in the Asian population.
Time out. US knees do not work well in the Asian market because, are our knees bigger?
Our knees, if you go historically, most of our knees were designed off of cadavers in Iowa.
Okay, you can put that down because the cadavers in Iowa got me. What does that mean?
Well, we have to start somewhere when we talk about developing sizes and shapes. So you have to look at, in the 70s, we didn't have access to CAT scans.
Right.
So we had to do cadaver work. And the place where most of the work was done was in the Midwest.
And does that have something, is the issue there, doctor, that
definite geographic variations.
Were they bigger?
Bigger.
Go ahead.
Definitely a different population that settled the Midwest versus other parts of our country or other parts of the world.
Hold on, time out. What about women? I
Well,
mean,
women's
hold
a
on,
whole
you're talking
different.
about men in the Midwest, right?
Yeah.
First of all, white men.
White men in the Midwest.
Versus someone who's not a white
versus
man
me.
Versus you, but versus a woman who has a different size knee, shape knee. Then how the heck are we then accommodating all these people who would need a replacement who didn't fit the bill?
Well, that's what the research showed. As we started giving knee replacements, they weren't doing so well in women or in certain populations.
What would happen?
More pain, experienced more pain, wouldn't get the same motion that we typically expect from knee replacements. So we started developing women's knees.
Women's knees.
That was developed about 7 years ago.
How are they different?
Smaller sizes, the shape is different. They're narrower rather than wider for every given. The two things in sizes we look at is the height and the width.
The height and the width.
So when we talk about the height of the implant, we talk about the height of the implant.
Right.
And when we talk about the width, we're talking about the width of the implant.
Right.
And every population or every gender has a different ratio of height and width.
And so let me ask you, in terms of people's, this is interesting. The average person who doesn't know all this,
It's very difficult.
so much of this is about education. Someone needs a hip, needs a knee replacement. how much of your work, the work of your colleagues at hospitals all across this region who are good at this work, how much of it is it, Doctor, about educating and informing patients about all these kinds of issues and the decisions they have to make?
It's important to educate the patients on, and I think every patient should have the right to ask what company you're using or what implant you're using, because there are specific differences among implants that are currently on the market. The general principle is the same of doing a knee replacement or the final outcome of a knee replacement, but the subtleties of it vary considerably among companies. And most high volume centers will usually have several companies' inventory available to them.
Okay, but one of the things that I also know is that not everyone has a, quote, team approach, meaning not every hospital, not every center that does surgery, this kind of surgery, has a team approach. What is a team approach and what isn't?
The team approach is the future of medicine, and the team approach is so important because it allows you to do high volume and it allows you to be highly efficient.
Who's on the team?
So on the team itself is your lead surgeon, your PA, your physician assistant, your nurse practitioner, and not only that, the circulating nurses, the anesthesiologist, the assistant to the anesthesiologist, the circulating nurses, and the nurses that take care of the patient on the floor, and the therapist.
Why do you need all those players?
Because it gives this patient a sense of continuity. And everybody has a role to do in doing the surgery. And it's so important that you get the right implants, the right surgery done exactly the same way all the time.
You know what's so interesting
It's
about it?
very mechanical.
Is it also, sorry for interrupting, Doctor, is it
Yeah.
also to say that part of the team is the physical therapist after the fact?
Yes, absolutely.
Why?
Because it motivates the patient. The physical therapy is so important after this surgery to motivate the patient to constantly move. It's one of the most painful operations you can get. You've operated on one of the largest joints in the body. You made an incision over the front of the joint, and the next day you're having them bend that knee. It's a task.
Before I let you out of here,
Yeah.
how long are best knee replacements lasting these days?
Most of the data we have say that it goes anywhere from 10 to 15 years. The newer generation operations are lasting between 20 to 25 years or longer.
And hips any different?
Similar in the hip.
Dr. Shah, I want to thank you. You
Thank
brought
you.
important information. But no, stay right there. Don't go anywhere.
Yeah.
You know, we like to move it nice and slow here at
Okay.
one-on-one. We appreciate it. Good information.
Yeah.
Stay with us. One-on-one will continue right after this. That was fascinating.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, the Russell Berry Foundation, Fedway Associates, Inc., PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons P.C. And by Health First New Jersey. Promotional support provided by the Star Ledger and NJ.com Everything Jersey. And by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.